Some of the clinical features of diarrhea and diagnostic approaches will be discussed next. The history and physical exam, the three main goals are: estimate the level of dehydration, identify likely causes on the basis of history and the clinical findings, and determine if additional studies and/or medications are necessary. The history, one should ask about the onset, the frequency, the quantity, and characteristics of the diarrhea. Namely, is it bloody, non-bloody, how frequent, the volume of diarrhea. Associated symptoms: is the patient also nauseated or vomiting? And often an infection with bacteria begins with nausea and vomiting as the upper intestinal tract is most affected, then can cause fever, abdominal pain as the infection moves down the digestive tract, and malaise or just generally feeling ill. The oral intake, what the patient has been eating or drinking, that may be the source, so that other persons in their environment can be prevented from acquiring this infection. You look for also, most importantly, the symptoms of dehydration. On physical exam, the vital signs are very important. What is the blood pressure of the patient? How fast is their pulse? Because as they have lost volume or have fever, their pulse will be quicker. The abdominal exam will indicate whether there is pain. Look for presence of blood in the stool, and most importantly, look for signs of dehydration. Laboratory evaluation is usually unnecessary for patients presenting soon after the onset of diarrhea, but may be helpful and necessary if patients develop bloody diarrhea, high fever, severe abdominal pain, or if they have other conditions that make them more susceptible to severe infection. And the evaluation would include CBC and checking their kidney function, particularly if you were concerned they might be developing the hemolytic uremic syndrome. And one can look for white blood cells in the stool, also bacterial culture, and if available, examination for ova and parasites, and if available, viral antigens. We have recently at my hospital had access to a new screening panel which checks for about 20 different bacteria, viruses, and parasites with one specimen. But this is new, expensive, and we are just beginning to find out whether this screening method is going to be of general use.